came with saggy tits. And now I'm leaving with perky ones. Yay. Right now I'm eating macaroni and cheese. My appetite is really good. So I'm just eating macaroni and cheese, saltine crackers. Have my bendy straw with my strawberry Gatorade. I'm just living right now. The pain is a lot better right now, and I don't know if that's because I took gabapentin. That's the pain medication that he gave. He only gave that, and then I took 2 500 milligram Tylenol. That combination is fine. Like, I'm not in any like pain, and at first I was like really worried that it wasn't going to be enough and that I was going to be in a lot of pain, so I brought like extra pain medication, but I don't think I'm going to be needing that. I feel like I have a lot of energy right now. Like, I haven't slept, and I don't know if that's weird or abnormal, but I'm not gonna like over exhaust myself and like do things that I shouldn't be doing. Like simple things like feeding myself, I feel like I can do, and I don't want my caregiver to have to like do every little thing. When getting the anesthesia, okay, let me start from the very beginning. We arrived at 10 o'clock, and that's the time that they told us to get there, and I expected to wait anyway. They said it's gonna be 1 to 2 hours. It was exactly 2 hours when Tatiana called me back into the patient like waiting room. It's comfortable and it's private, and they gave me my gown. They gave compression stockings, gave me socks, and then I signed some more paperwork, and I don't remember his name, the anesthesiologist came in and he asked me questions, and then Dr. Miami and Tatiana came in, and then that's when he like did the markings and explained everything, and you could see where certain things were going, like moving my nipple up here because my nipples, I guess, were too close together, too medial, he said, and so he needed to shift them a little bit. So my scar is going to be a little bit diagonal, but I don't care, and that scar goes away a lot easier than the one underneath. I don't care about the underneath scar. Do you care? I didn't think so. He explained the possibility again of losing your nipple, and he said that there could be a chance where I wouldn't get the implant and it would just be the lift because the nipple like didn't get proper circulation. But thankfully I was able to get the implant, I was able to get the lift, and I do have sensation in my nipples. I don't know if that's gonna go away, but like everything just went so good, and I'm like so happy. Like right now I could probably cry because I'm like that happy with everything, and I feel good. Like I'm not in any pain. He lipoed my, I'm really like getting emotional about it. Oh my gosh. Before, like I was like really insecure with everything, and then now like I'm just like really really happy, and I hope everything like heals properly. And what else? I guess just stay tuned for like more recovery. That's all. Day 2, post breast lift and augmentation, and I feel really sore. Like I just did a bench press, but like I have some bruising from the lipo around here, and just from, I guess, the surgery itself. Just really sore, and I have a lot of energy, even though like the pain medication that they gave me is supposed to make you groggy, and it does make my vision a little bit blurred. Not blurred, it's just delayed. But right now I'm fine. I'm not in any serious pain or discomfort. Like I still want to like get up and like walk around, and I know you're not supposed to do that within the first like 24 to 48 hours. I think I'm moving around a little bit too much too, because my stitches underneath started to bleed, and they were bleeding like, well, first the lipo incision was bleeding a lot, and then I noticed like underneath this scar this incision was bleeding. So I called the hotline, and I just spoke with a nurse, and she just told me to send her pictures. She wanted updated pictures in the morning actually, and to just put gauze on it. I don't have any gauze, so I'm just using napkins and a rag, a clean one. But the bleeding has gone down a lot, so I'm not too worried about it. The nurse is going to come at some point today, and then I have a follow-up appointment with Dr. Miami on Tuesday, and hopefully everything looks good. Everything feels good. It looks good to me, and I'm like really excited and happy. Can't wait to get the stitches off. Or not stitches off, I can't wait to get the bandages removed. I think that's about it. Sleeping wasn't that hard. but I think I should be more tired and I should be sleeping more so my body can rest and heal better. I'm in Miami, so it's kind of hard. I want to go explore. And that's it for a day. It's almost been 48 hours and I got a video from Dr. Miami. He sends like these automatic like emails to people who have surgeries, and in his email he said you should expect a lot of swelling and soreness, swelling, soreness, and bruising, which is absolutely correct. The bruising has increased and the swelling has also increased. Soreness, like 100%. As far as like being limited to do things, just don't overextend yourself. I mean, I'm fine though. I'm gonna go out and stuff, but I'm trying to think of like anything important to say, and I can't think of anything other than swelling, soreness, bruising. Whoa, this wind. Wait a minute. Today is the last time I'll be seeing Dr. Miami. It's really sad, actually. Follow-up visit. This would be day 3. I'm sure he's just gonna look at everything, look at the swelling. It'll probably take like 2 minutes. I don't know, I'm really sad. I don't wanna like leave. I wanna stay here forever. Waiting. I don't wanna talk too loud. But we're in the waiting room right now for my follow-up appointment. I think the wait shouldn't be too long. They wanted to schedule me for 1 o'clock, but I didn't get that missed call until 1 o'clock. So it's now 1:30, which is my scheduled time. I don't know why they wanted to move it. Maybe he has somewhere to go. People to see. I'm kind of sad. I don't want to leave. That's it. I don't have anything to say. Oh, I'm very Miami vibes today. Hold on. You see? I'm still a little bloated because I haven't had a bowel movement in 3 days, which is probably too much information, but you're supposed to have a bowel movement within the first 48 hours. Hopefully I have one soon. Like leaking.
Leaking a little bit? Yeah, that's common. If the T-junction there is going to leak a little bit. Just reinforce that with some tape and a little piece of gauze to where.
I feel like there's like a bubble there too.
Where?
Like, well, I don't know if I just like, oh, right here. I don't know if you want to feel it. I don't know if it's like capturing the...
Yeah, no, it could be a blister. Sometimes because the tape, it like expands,
okay.
Or your skin expands and the tape doesn't, so it kind of pulls the skin off a little bit.
I'm going to tuck this on.
They look beautiful. You happy?
Oh, yeah.
They're a little bit swollen. They're going to come down a little bit. So don't fall. I don't mind. Okay. Don't fall in love with the size because it's going to get a little bit smaller as the swelling comes down.
No, that's fine. They're really big. So.
All right, cool. So let me see this under here. I'm going to take this tape off.
Okay.
All right. Sorry about that. Yeah, you have a little blister there. It's okay. I'm sorry. Go ahead and cut the tape there. A little bit of gauze and some betadine. Okay, thank you. Yeah, you were feeling a little bubble.
Okay.
No, it's all intact though.
Okay.
Cool. I'm going to paint it with some betadine. Put some more tape on. Okay. How long are you in town for?
Until tomorrow.
Okay. Listen, you cannot lift anything heavy. Be very, very careful on the plane. All right. Don't like even try to lift your hands over your head to go to the overhead bin or anything like that. Okay. You have to really be like a baby.
We are a little bit open.
You have to treat her like a baby, okay?
I have been.
Okay, good.
Yeah, he's been getting mad at me.
Listen, it's necessary for the next week.
Okay.
You look beautiful. Just remember to send me pictures.
Okay. To the hotline?
Yeah. Every day for the first week.
Okay.
Then once a week for the first month. And then at 3 months and at 6 months. Or in between if you have any questions.
Okay.
I would like these tapes to stay on for 1 full month.
Okay. And no bra
from the
for a
surgery.
month?
And no bra. Mm-hmm.
Not even like a bralette.
I prefer nothing if
Okay.
possible. If you need to, you
For,
can.
like, work purposes.
For work purposes, yeah, that's fine. But,
Okay.
you know, take it off when you get home.
Do you have stitches under your under your arm? Do you have stitches?
No.
Oh, yeah, she might. Let me see.
Just to make sure. Maybe. No?
If you turn this way, it looks like it fell off. That one fell off. Let me see this thing. That's good.
Perfect.
Good. How many days has it been?
It's Friday.
3 days?
You heal fast.
I kind of had a feeling I would.
You heal super fast. Good for you. Okay. Maybe one more piece of tape that's under here just to reinforce that T-junction as well. All right, so she's going to go over a little Beauty Warrior survival guide with you. It'll answer like 99% of the questions you have. If you have any more after that, just send them to the hotline.
Okay.
Here, let me know.
A little over 72 hours. Today I thought it would be wise to like not take my pain medication because I didn't think that I needed them. But I think like I realized that I do need them. I don't know what it was, but like after I napped today, like my right breast felt like it was so fucking swollen and it's like so uncomfortable. Visually, you can see a difference between my right and my left breast. My left breast is less swollen and has like fallen down a little bit. I don't want to say like fallen down completely though, because they still seem kind of like even. Just one just like looks way more swollen than the other. And like when I lay down, I don't know. I don't think it's like painful. I think like I'm having like anxiety or just like a panic, like not a panic attack because that's dramatic, but I'm like kind of freaking out a little bit. Like, why is this one way more swollen than the other? And then it's like on my mind a lot. And so now I'm like sitting here like kind of like anxious, like pacing and like not wanting to lay down. But then again, like sitting up and like not being able to like stand comfortably. I'm just like tired of feeling like the pressure that I feel like right now. I'm fucking tired of it. Like I want it to go away. I just want them to drop. The feeling of having that loose, relaxed muscle is what I'm missing, and making me feel like I'm trapped or like suffocated. I feel suffocated right now. Like I'm in a tiny little box and I can't fucking breathe, and it's like so irritating, and the thought of me being on a plane tomorrow like making me feel even worse. But I just took gabapentin, so hopefully I'll feel how I was feeling like all the other days, which was completely fine. Feeling like I could conquer the whole world, but now I'm like freaking myself out and it's really annoying. But I don't know if I'm just like worried about like traveling, being on a plane. I think that's it. What he did was he changed the tape out. I told him that I had like it felt like I had like a bubble, and I realized it once we got there actually, and he was like, oh well, sometimes people get blisters. And so when he removed the tape, I think he like took the bubble with him too, which is good, because if I would have seen that after and he didn't remove the tape, then I would have like been freaking out even more. Yeah, I would have freaked out if he didn't change it. Yeah, I guess this is it for the Miami trip. Like, sad but happy to be going home, but nervous to go back to, or nervous to adjust to my lifestyle, like with this limitation. It's gonna be interesting. But I think I'll probably post like a follow-up video like 1 month later or 5 weeks from now and show like how they've dropped and how my experience was with the things that I can start doing like throughout like these weeks to come. And back to California we go.
Yeah. That's the way every day goes. Every time we've no control. If the sky is pink and white.
So, as I get comfortable here, please enjoy the show, continue watching, and give this video a thumbs up. But more importantly, if you know of anyone who is interested in getting breast lift with augmentation, please share this video.